This is Dr. Stephen Daniel, the founder of Quantum Techniques. I've been doing this work for 26 years and I love it. You know, it's always innovative and learning new things to heal. Something I learned from, I think, a master teacher, Neuralink, the founder of Neuralink. And he talked about a unilateral muscle issue that causes a lot of pain, a lot of chronic pain. And what that means is, let me give an example. You have one or more muscles in the body that are weakened by a pathogen or toxin. Because of that, they can't hold equal torque. One part of the body is much weaker than the other. So imagine you're behind a sub car, a real tiny car, and there's an 800-pound driver, and you see the car really tilted way to one side. Well, if you want that to run level, like we want our bodies, you're going to have 6 guys lift the fenders and get it level. Okay, so we're looking at, why is the body unlevel? Many times, people are getting surgery because what causes it is not available to see on an MRI or blood study. So, and it can become chronic. If you didn't do anything to injure yourself and all of a sudden you've got shoulder pain or neck pain or lower back pain, especially lower back and neck pain, there's usually a simple cause, and most common, it's either a spider bite or a virus or a hidden bacteria that's hitting the UTI field. So if we look at that for a second, I find it's not that common that it's actually a disc or the bone or even the nerve tissue. Now, we do find those. Number one issue for recurrent or chronic neck and lower back pain and back of the shoulders. So, if the pain is in the back of the shoulders, like the shoulder blades, well, that muscle is controlled by the stomach, hypothalamus, and liver. So you may also have sleep or temperature dysregulation. But the lower back and even, quote, sciatic pain and neck, when those lock up, those muscles are controlled by the bladder, the kidney, and the adrenals. So if you find out what's stressing them, connect them to the body, which we do with our work, and say, what's causing this? Again, most often, new pathogens, new viruses with activated old opportunistic bacteria. Spider bites, sometimes it's a toxin that knocks that out, not as much as virus and hidden bacteria, and sometimes bites. But again, if you're going to a chiropractor or massage therapy week after week after week to put you back online, so to speak, or crack your back, and there's nothing wrong with those therapies, they're not damaging. We ask a different question. Why isn't it going away? We're not asking, what do I adjust to make me feel better for 2 or 3 days and then come back? We're asking, why is it there to start with? And I've actually known 2 physicians that were orthopedic surgeons that after working with them and their families, they retired from their practice because they said they realized they weren't really helping the people with what the real issue was, but they were spending a lot of money with them and causing scar tissue. Because, surgery always causes scar tissue, which has its own issues as well as anesthesia. So let's see what we can fix naturally. There's always a place for surgery, but it should be the last place, not the first place. And again, unilateral muscle from a virus, not going to show up in a blood study, MRIs, CAT scans, they're not going to show up that way. But we can find them and fix them rapidly with quantum techniques. So again, more tips from your health, for your health from Quantum Techniques from Arizona, and I hope you have a blessed week.